And turning now to our top story, after another round of unsuccessful negotiations this morning, Kapiolani union nurses expected to walk the picket line. Our Cynthia Yip is at the hospital now, where nurses are already gathering ahead of the strike. Cynthia, good morning.
Good morning, Leah. That's right. Negotiations between the Hawaii Nurses Association and Kapiolani Medical Center ended at about 3 o'clock Thursday afternoon. So in about an hour, the nurses will be striking officially at 7 o'clock this morning. And after that, the hospital says it will be locking out its nurses. And as you mentioned, some of those nurses are gathering right now just behind me. Now, that lockout is expected to last until unionized nurses accept the latest version of Kapiolani's proposed contract. Now, during the lockout, the hospital will continue its operations with travel nurses. Kapiolani's nurses are fighting for safer staffing conditions, saying there's an uneven nurse-to-patient ratio, making it dangerous, they say, at times for those in their care. HNA says the nurses stand behind making patient safety a priority over their own jobs.
Somebody today was sharing some testimony to the other side, and sometimes it's just, no matter how much work you're doing during your shift, just being able to hold, let's say you're taking care of the baby, and just giving them the TLC that their parent can't give them because they're not there at the bedside, that you're able to give that moment to them. They won't know, they're young, they're little babies, but you know that you're giving them the best care you can. Hopefully, the next 24 hours, we're going to be surrounded by a lot of people who support us.
Kapiolani says the nurses will lose their medical and dental insurance coverage on October 1st. If the lockout goes beyond that, the nurses will have the option to continue the benefits through COBRA. Kapiolani's Chief Operating Officer, Gidget Ruseta, says the hospital went in ready to negotiate as long as possible yesterday, but the union walked out after less than 3 hours. After yesterday's bargaining session, Kapiolani says it's focused on maintaining operations and, quote, "We are extremely disappointed that the Hawaii Nurses Association decided to end talks early, which will lead to a strike and lockout for our nurses. We want to reassure everyone that Kapiolani has secured a highly skilled temporary workforce and will be fully staffed in order to provide uninterrupted care," end quote. Now, Kapiolani nurses have been working without a contract since late November of last year. And again, that strike is starting actually right now. As you can see, they are starting to gather. And coming up at 6:30, we're going to be talking with Kapiolani Medical Center's Chief Operating Officer, Gidget Ruseta, about their reaction to the strike and what will be happening during this lockout. Reporting live from Kapiolani Medical Center for Women and Children, Cynthia Yip, Island News.